story you're about to see is not true. The names have been changed for no reason, but this is just to give you an educational view of what not to do with your medicines, especially something as serious as coumadin, which is also warfarin. Hi, Mrs. Mental. Why don't you just come on in? I need to talk to you about a few things. My nurse called me and said that your husband called and he's kind of concerned about you. Doctor, I don't know why he's so concerned about it. I got a few problems, but I think he's making a big thing out of nothing. I don't mind talking about it, but I don't really know what his problem is. Mrs. Mental, what's going on? You have some blood that's not connected up, and you've got your nose looks like it's bleeding. Have you been taking your coumadin like you're supposed to? How long is this stuff that's been going on with you? Coumadin? Warfarin? I don't have anything like that. I like this Lovenox. Like Lovenox. Isn't that the same thing? Well, anyway, listen, all I remember is, do you remember the time I had to call you to tell you I'm having a heart attack? I thought I was having a heart attack. The pain. And then they found I had nothing, but they did find, because somebody pressed on my leg, my foot, and said, oh, you might have a blood clot in your leg. I don't know, was the thrombitis something, relativitis? Anyway, I know they told me that I needed something to thin my blood so that to prevent any clots, because they didn't want to go into my heart and kaput, I'd be dead. So I've been taking it. I know I'm supposed to take it with water, but I didn't have any water. The water got turned off, so I took it with my vodka. Clear fluids, figured that would be the best. Same thing, water, vodka, what's the difference? I know they told me I had to make sure that it was, what was that, 37, 35 Fahrenheit? Or was that Celsius? Anyway, I put it in the refrigerator because I wanted to know, make sure. I couldn't remember which it was, but I think it was supposed to be in the refrigerator, someplace nice and cold. Then, I don't know what happened. All of a sudden, I started getting nosebleeds. My mouth started to hurt. I wasn't feeling good. I even started to get black and blues. You want to say them? And Mrs. Mental, I can't believe what I'm hearing. This is the book I gave you. My nurse talked to you. I talked to you. In fact, we had a talk about things that we needed to do even before we put you on this medicine. The reason we put you on this medicine is because we needed to thin your blood, to avoid any clots, and to avoid having any major life-threatening illness come to you. And everything you have done has completely done the opposite, and you obviously need to go to the hospital right away. We've talked about, they asked you if you had any bleeding problems. You said no. They asked you if you fell often, and I know that you stretched the truth because I know you like to do a little nipping here and there. But we even talked about that. We talked about no alcohol while you're on this medicine. We talked about your food choices. I know how much you like your greens, and you said we can do still that in moderation. But we needed to make sure that we did not make too much vitamin K in your system, because that would have offset the therapeutic effects of this medicine. Mrs. Mental, are you listening? This is very, very important. We even talked about diabetes. We talked about everything. Double-checked your high blood pressure. And I didn't even take your word for it. We had all the tests done. I can't understand how you read the complete opposite of everything. It's not supposed to be in the refrigerator. It's supposed to be at room temperature. It's not supposed to be taken with alcohol. It's water, water, water to help flush it through your system. I'm not sure what I'm going to do with you, but I do know I need to get you to the emergency room and get you admitted immediately into the hospital. Now the following slides will be a little bit more of a direct showing of what coumadin is and how it works on the body and the precautions that we need to take.
Warfarin works. Vitamin K helps stop excessive bleeding through clot formation. Sometimes, though, clots can form too readily and block blood supply to vital organs. When that happens, warfarin hinders the action of vitamin K, resulting in thinner blood and fewer clots. Warfarin is often prescribed for people who have suffered heart attacks. It can be used to prevent the formation of a pulmonary embolism, which is a blood clot in the lungs, and to prevent venous thrombosis, which is a clot in the veins. Patients with rapid or irregular heartbeats and those who have artificial heart valves may also take this medication as a precautionary measure. Warfarin can be taken orally in tablets from 1 to 10 milligrams. While taking warfarin, you should be prepared for frequent blood tests to measure your clotting time. The two most serious side effects of warfarin are gangrene and internal bleeding, but be sure to ask your doctor for a complete...
Mrs. Mental, I hope you listened to how that whole tape went. And for everybody else, please listen to your doctor. Take your medicine as prescribed. This could be from life to death